This is Dr. Scott Spear, Affiliate Medical Director of Planned Parenthood of Arkansas in Eastern Oklahoma, and you're watching the Caine interviews on CAT TV.
Hi, I'm Shannon Caine, and you're watching the Caine interviews. Today's guest will be Dr. Scott Spear, who will be talking to us about Planned Parenthood. He's a medical doctor who's involved with Planned Parenthood regionally, and we'll be discussing Planned Parenthood and the various services that it offers, and we'll also look at potential controversies regarding this organization, in addition to learning a bit about the history and mission of the Planned Parenthood organization. Dr. Spear, welcome to the show.
Thank you.
Okay,
Pleasure to be here.
Thank you. How long has Planned Parenthood been active in the Fayetteville area?
Well, Planned Parenthood in Fayetteville is part of an affiliate that involves Arkansas and Eastern Oklahoma, and the affiliate joined and became part of the whole area within the last several years. So there's been a Planned Parenthood presence in Fayetteville, I believe, for a number of years, but just recently became part of the Planned Parenthood of Arkansas and Eastern Oklahoma about 12 or 15 years ago.
Okay, well, speaking of Planned Parenthood of Arkansas and Eastern Oklahoma, what is the difference between the PPAEO and the PPFA?
Well, PPFA stands for Planned Parenthood Federation of America, and it's a federation of about 115 affiliates, of which Planned Parenthood of Arkansas and Eastern Oklahoma is one of a mid-size. There's some large affiliates that involve a whole state. There's one affiliate that involves a number of states, and there are a number of states like Texas that have 10 or 15 smaller affiliates. So we're an affiliate that has clinics in Tulsa and clinics in Fayetteville and Little Rock, and we're one of the mid-sized affiliates in the federation. You could sort of see it as a franchise. We have to meet certain standards and follow certain guidelines that the Federation puts out so that we can have the nested Ps that you probably have seen around that you would identify as being a Planned Parenthood site.
Okay. Aside from family planning, what services does Planned Parenthood offer?
Well, this Planned Parenthood affiliate offers prenatal services. Those are available in Tulsa to women. We're, I believe, the second largest Medicaid provider of prenatal services in the state of Oklahoma. We also provide pediatric services in our site, one of our sites in Tulsa. We've just begun offering services for vasectomy services. Those are also available now in Tulsa. And we have medication abortion services available in Fayetteville and now in Tulsa as well, along with the typical family planning services, male STD services. And so we're really looking at ourselves as reproductive health for both men and women.
Okay, now in terms of family planning itself, what services are available there?
Well, certainly pap smear, so screening for cervical cancer, screening for breast cancer, screening for sexually transmitted infections, the whole range of prescription contraception. We also have Plan B or emergency contraception that people can come in and buy from us. They can also get it from a pharmacy now as well, although if you're 18 or if you're under 18, teenagers still need a prescription to get Plan B. So the prescription family planning services. We have Implanon, which is a new method of birth control. We supply IUDs. We can insert IUDs. A lot of clients choose to use Depo-Provera, which is the injectable contraception.
Okay. Could you give us a brief history of the Planned Parenthood organization?
Well, Planned Parenthood is well over 90 years of age as a movement. The Planned Parenthood Federation of America, with a number of different clinics, was started by Margaret Sanger in the early part of the last century. And initially what she was doing was illegal in many states. In fact, she went to jail for just giving information. She wasn't even providing services. There were very few services available at that point. But just telling women how they could delay pregnancy was, at that point, led her to be taken to jail. So the movement has been one of expanding these kinds of services. There were obviously great strides made in the mid-1960s with legislation that allowed first married women to get contraception. There were even states in the mid-1960s, hard to believe that, but there were states where even contraception was not legal for married women, and then subsequent ruling by the Supreme Court made family planning and birth control services available legal for unmarried women. So those are the kind of things that Planned Parenthood has been about. Again, each affiliate can offer a range of these kinds of services. Not all of them offer prenatal services. Very few actually offer pediatric services like we do. There's certainly many that are offering abortion services, both medication and surgical abortion services, as well as some are providing services for families and for primary care, and acting like the primary care provider for a number of groups of people in some affiliates.
Okay. Now, Planned Parenthood is a controversial organization in some circles, particularly regarding the abortion issue. Could you comment on that?
Well, the vast majority of what Planned Parenthood does is to prevent abortion. We're one of the largest providers of family planning services, and there's lots of evidence that it's birth control and family planning services that prevent abortion. So and when you look at the national polls, anytime polls are taken, about the only organization that rates higher in terms of positive feedback, I believe, is the Red Cross. Planned Parenthood is again very highly rated, and I think it's because of the fact that we provide these needed services for teens, for women who don't have other kinds of coverage, and that's always been the kind of audience and the kind of population. We also do, in many places, serve Medicaid, patients with Medicaid. We serve in some sites, patients with insurance programs as well. So those are, I think that it gives us the ability to be doing some of the more controversial kinds of advocacy work that we do because we have such a strong backing and strong, high respect by the public for what we do in terms of services.
Okay, now how large a percentage of Planned Parenthood's services actually consists of abortion?
It varies from affiliate to affiliate, but it's certainly a very small percentage in our affiliate, less than 10% of our visits. And I would say that probably holds true for most affiliates around the country.
Okay. Now, has the Fayetteville Planned Parenthood office ever been picketed or threatened with violence?
Not that I'm aware of. I think that this is probably going to be one of the places we have patients that have come to us now for several months for medication abortion. We haven't done any public advertising about it, so it's been sort of a word of mouth. I think there's still people, when they come to picket in front of Dr. Harrison's office. We're not longing to have pickets there, but I think we're capable of dealing with people who might have different opinions from us. But at this point, we have not. We've had some controversy that we've stirred up in Tulsa with some of our activities.
Okay. What are some misconceptions about Planned Parenthood that you'd like to clear up?
Well, I think the biggest misconception is that all we are is an abortion provider. And I think that, again, the fact that we have this broad range of services, even including pediatric services, shows that that's not what we're about. We're about trying to provide needed services to several communities in the Northwest Arkansas and Central Arkansas and Eastern Oklahoma region. And that's where I think we get a lot of respect from the community for doing that. And I think that it's amazing. People who may say, well, I'm against abortion, may find themselves in a situation where they need one, and they are happy to have us there. And I think that the reason that people are aware that we have these services is because Planned Parenthood has a name of being a place you might go if you were interested in getting an abortion. But that's, again, not the primary role, and we would much rather prevent the need for abortion by having women and men use contraception effectively.
Okay. Does Planned Parenthood engage in political advocacy?
This Planned Parenthood is what's known under the IRS code as a C3 organization. There are affiliates that have a C4, which can do actual lobbying and political work. C3 can do a very small percentage of its work as advocacy, but not saying we're for this person to be elected or that person to be elected. But we can advocate for certain certain laws to be passed or others not to be passed as a small piece of what we do. Yes.
Okay. Now, some people think that Planned Parenthood is geared specifically toward women. You have mentioned vasectomy services.
Correct.
What other services do you have that men can use?
Well, we also have services. We have a Title X clinic in Tulsa that has been doing sports physicals for young men as a way. Young men tend to not go to doctors. Mm-hmm. Women, because we tie getting a pap smear and annual exam to getting birth control, are more likely to go to physicians than men are. So we're looking for ways to get the men in so that we can talk to them, get them screened for sexually transmitted infections. There aren't any prescription methods except for vasectomy that men would use for contraception. So, but we're looking for ways to engage men. We want to have magazines in our waiting room that are not just women's magazines.
Right.
And so I think in terms of being there for men, we certainly are seeing men for sexually transmitted infections in Fayetteville and in Tulsa. And so I think those are reasons that men come to the clinic. But we want to get them also coming for more primary care reasons as well.
Okay. What is emergency contraception? How does it work?
Emergency contraception that's currently available is a pill called Plan B, and this is a progesterone-only birth control pill, meaning it doesn't have it's like the common birth control pill, but those pills generally have estrogen as well as progesterone. This is a high-dose progesterone. It's taken as a single dose. The prescription says you take one dose and then repeat it, but it works well and is easier to do as a single dose of these high-dose progesterone-containing pills. And they appear to work by preventing ovulation or delaying ovulation. And they, depending on how closely they're taken to the episode of unprotected sex, they can decrease the risk of getting pregnant by 87 and sometimes as high as 95%, decreasing the risk of having a pregnancy by that high an amount. Probably again by delaying the release of an egg. Does not cause an abortion because this works before the egg and the sperm come together, and certainly before a fertilized egg implants in the uterus, which is when a pregnancy starts. So it's a contraceptive method that can be used after you've had an episode of intercourse that you're worried about perhaps having contraception not being available or not working.
Okay. Now, occasionally one hears news about pharmacists who refuse to dispense contraceptives. What is your opinion on that?
Well, I think that they're violating the ethics of their profession. Our job is not to put our values in place of the patient's values. We get licenses from the state, and so I think that implies that we have a public responsibility. There are many jobs where you don't have that kind of a public responsibility, but being a physician and being a pharmacist, is a license. You're licensed. In fact, I can't dispense medications. I can prescribe medications, but my license doesn't allow me to dispense. So that's why I think the pharmacists have a responsibility to the public to meet the needs of their patients. I can understand if there are some moral qualms about it. I think it's erroneous to say that Plan B or birth control pills cause abortion. That's just inaccurate. I mean, I think, first of all, they shouldn't be in that profession, basically.
Yeah.
If they are, I think they need to be in a place where they're not going to have patients coming in and requesting these kinds of medications. Because, again, we're there to meet what the patient needs in terms of what's best for the patient's health, not what's best for our personal values. And if we're trying to put our personal values into the situation, then I think that violates the ethics of both the profession of pharmacy and the profession of medicine.
Okay. Now, is Planned Parenthood funded by the state or the national government in any way?
We do get some funding from the state through the Medicaid. There's now a waiver, a family planning waiver, so patients that are 180% of poverty or below can receive funding through Medicaid, which is one federal program. There's also Title X, which is another federal program that has very specific parameters. That's we only have one clinic that does Title X. But yes, we get some funding through federal mechanisms. We also get funding through patients paying us for services. There are a number of self-pay patients that we see. And that's primarily how we're paid for our care.
Okay. Now, if a person wanted to learn more about the services offered by Planned Parenthood, how could they do that?
Well, the website, I believe that we're going to be putting up www.ppaeo.org is a good resource for them to go to. The general PPFA site, also they can go to ppfa.org. And if they're not in this area, they can be. There's a number they can go to that on the site, and it allows them to find a clinic in their area.
Okay, all right. Well, that's about all the time we have for today's show. But thanks so much for being on.
My pleasure.
All right.
Thank you.
You have been watching the Caine Interviews on Channel 18. That's Community Access Television, Fayetteville, Arkansas. And stay tuned for more interesting programming. Don't touch that dial.
When I was young, my mother told me not to question authority. Don't fight the system, she told me. They'll get you every time. My guidance counselor said gas and grapes don't mix. When it was my head I was trying to fix. Mother Nature, it ain't what you told me. It hurts me when you lie. I'm just leaving with what I came with. All the king's rules I'm rearranging. Suing Mother Nature, 'cause I'm jaded. The promise she gave me, I'm through taking. When I was young, I stood on a ledge and laughed. Dad got to take me if he asked. Now I deal with mortality, a bad case of reality. And then I thought you could master yourself, pass your problems to someone else. Mother Nature, it ain't what you told me. Time